Hi everybody, and welcome to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. I'm Sam Lassant, and we're at the Wellness Center today. A great show on learning about hearing. A lot of great information, and thank you for those nice words and comments that we're getting on the shows. We try to bring you, at least Lehigh Valley Hospital is trying to bring you as much information as what they offer. Today we're going to learn about hearing loss, and we're going to be joined by Dr. Ravi Samy, who is the Professor in Chief OHS. Here at Lehigh Valley Hospital, also head and neck surgery. Now, before we talk to Dr. Samy, I want to show you this video.
My inspiration and role models in my life are my father, who's a physician himself, as well as my brother. My father's a psychiatrist. He's 87. He continued to work until he was 85. And my brother is a retinal surgeon. So they both have incredible passion in their lives to serve others. Both of them have been great role models for me. I'm Dr. Ravi Samy, Chief of Otolaryngology, Head and Neck Surgery. I'm also a neurotologist, skull-based surgeon at Lehigh Valley Health Network. When you come to see me, my goal is to build trust, rapport, and good communication with you. My goal is for you to feel like you're a part of our family and that we will take the best care of you as possible. I chose my specific specialty kind of by chance. I do what's called neurotology skull-based surgery. It's really a super specialized field. There are only about 400 neurotologists across the country. So the goal is to introduce procedures and skill sets that typically aren't available unless they're involved with large academic medical centers. So taking care of pediatric patients with skull-based tumors, as well as adults, and doing cochlear implants and certain clinical trials with implantable devices. These are things that really excite me and inspire me.
Joining me now, of course, is the man himself, Dr. Ravi Samy. I like to call him Sammy, but he said, no, it's Samy, okay? Doc, nice to see you.
Pleasure to meet you,
And
sir.
nice to meet you, too.
Yeah, absolutely,
okay?
my honor.
Now, I'd like to say the word, but I have trouble saying the word, but I'm going to have you say it. You're Professor in Chief of OHS. Now, listen to this word.
So it's otolaryngology, head and neck surgery.
Yeah.
Historically, a lot of people would think of that about ENT, ear, nose, throat.
Yes.
But that's a 100-year-old term for a specialty that in the last 100 years has grown quite a bit. I focus on what's called neurotology skull-based surgery. Yes. So cochlear implants for deaf kids and deaf adults, tumors around the skull base, acoustic neuromas, meningiomas, a lot of different diseases and disorders that involve the ear and what's called the lateral skull base.
Okay. Now, we just saw a video. Explain to our viewers what, I know they saw, but let's talk about what that video contained.
I think one of the keys when you're treating patients is to say, what would I do if that was my mom, my dad, my wife, my daughters? And I think it's important there's a sacred relationship and a bond and a trust between physician and patient. And so in my mind, I have mom who's 88, dad who's 89.
God bless.
And they both deal with hearing loss. And it's hard to see as your parents get older. Over the years, my mom has struggled more and more to hold conversations, especially when it's a crowded area, when there's a lot of family around. I can tell talking on the phone is getting harder and harder for her. Hearing loss, many people may not realize, is the #1 cause of dementia worldwide.
Wow.
It's also the #1 birth defect. So if you look at all the ages in between newborns and elderly, and you realize how much hearing impacts quality of life. So for example, you and I even conversing here, you and I having this interview, we just take it for granted that you can hear well.
Exactly.
But that's not always the case.
Tell me about you, who you are, and what you bring to the table.
So I was born in Madras, India, now known as Chennai. I came at the age of 4. I have an older brother who's a retinal surgeon. My dad's a psychiatrist, retired now. So I've always had a family of great role models for me. I grew up in Texas, northwest of Dallas. I went to Duke University for undergrad and medical school, Stanford University for residency. Then I did a 2-year fellowship in neurotology, skull-based surgery at the University of Iowa. Most recently, I was at the University of Cincinnati Children's for 17 years. And I was recruited here to head the otolaryngology head and neck surgery program. So it's over 15 physicians, multiple sites in Lehigh Valley, and then of course Hazleton, Scranton, and Pocono. So a lot of physicians, a lot of physician assistants, and a lot of audiologists. So it's a big group.
It's interesting. I've been doing these shows for many, many years. In fact, probably this is well over 6,000 shows I've
Wow.
done. Yeah. But I always find it interesting when I'm interviewing a doctor, is the passion that they have for what they do. And I could just see you have that passion in you, which is great. And it resonates with all the people, your team.
Oh, very
Am I
kind of
correct?
you.
No, I mean that sincerely. You could tell that. And I think anybody who's going to a doctor, first of all, they don't want to go in the first place.
Right.
And there's always this unknown and fear. But to have a doctor with good bedside manners and knowing what they understand,
Right.
okay, is important. When did you decide that you wanted to, I mean, you see you have a background of doctors. When was it did you decide you wanted to go into this field?
It's interesting. I think when you look at your life, it's actually not a straight path. It's also often very circuitous.
No kidding.
So when I was in high school, I wanted to be a cardiac surgeon. That was my first love and passion. And so when I went to Duke, there's a legendary surgeon there who has since passed away named David Sabiston. He was a role model for me. I worked in his lab. He was the chairman of surgery. He has since passed away a couple of decades ago. But I think this idea of my role model is my dad and my brother. Dr. Sabiston was my first role model. This idea of you have a sacred bond and trust between you as a physician or surgeon and your patient. Because when a patient comes to you, they're actually very vulnerable at that point in time.
Yes, yes.
And in addition to that, you're doing something invasive to their body as a surgeon. So that patient has to be willing to put trust in you. And I think a lot of this now is, I'm 56, I've got twin daughters who are 16, the generational change that I'm seeing, and my goal is to pass it on to the next generation and say, it's not about the knowledge, because knowledge can be found off Google or now AI. What patients are looking for is how do you weed through all those things that are online. You and I know that a lot of patients that come in and say they're scared by what they read online, because online it may say you have this tumor,
Yes.
you have this cancer. So they're looking for someone who can guide them, who can trust them. And I think that's my job now is, I've got, God willing, 10, 15 years to go, give or take, right, in my professional career. And I've got to pass the baton on to the next generation and say, all right, I want you to now see that patient and treat him or her with kindness, dignity, and respect, and treat them like a family member. And I think you've seen that generational change, right? That sense
Absolutely.
of professionalism that if we're not careful, and I don't know how much of that's pandemic related, but I think things have changed a lot post-pandemic.
So, talking about this team here, let's talk about the team you have. What do you bring in to the team in terms of working with the different doctors here and making this first class?
So that trust and rapport you build not just with your patients, you have to do it with each of your individual physicians. So at this site here in Hazleton, we have outstanding physicians, Tom Pollack and Darren Hahn, wonderful doctors and good friends of mine, good colleagues. And so I'm happy to come here actually for this interview because I haven't seen them here at the site in a while. And it's nice to break bread together and
Sure.
spend time together. So you already have two physicians who've been here since the year 2000. They're well known in this community. And so they already represent the first line of if there's anything in the head and neck, anything related to otolaryngology, they can handle the lion's share of that. If it's more complex, then they send it to us in the Cedar Crest location, which is our level 1 trauma center, and that's where my clinic is. But in addition to them, clearly there's front desk staff, there's medical assistants, and then in this segment, we're talking about hearing loss.
Yes.
So we have two audiologists, Heidi Fiorelli and Leeann Yetter, who's newer to the group, and both of them are working in conjunction with them. For otolaryngologists, since we do so much work with hearing loss, we have to work hand in glove with an audiologist.
What are some of the primary causes of hearing loss?
So everything from noise exposure, that's very common. Unfortunately, aging within the cochlea, there are hair cells, and those hair cells die off over time. Different medications, I have some patients who, they are doing well because they had chemotherapy to treat their cancer. Unfortunately, that chemotherapy has caused hearing loss. So there's a variety of things. There needs to be proper diagnosis for each patient because there's usually different types of rehabilitation available.
When should you get evaluated for hearing loss?
So it's interesting. I will tell you, we are probably under-evaluating patients. If you think about it, you go to your primary care doc ideally every 1 to 2 years. You see your dentist every 6 months. Maybe you
Yes.
see an eye doctor every year. I think we should have patients in America and throughout the world have annual hearing screening in one form or another, and we don't do that at all. We wait until patients or their family members say, my spouse can't hear me well, or I'm struggling. Hearing loss impacts us at work.
Yep.
It turns out if you don't hear well at work, you often don't do as well. Maybe you get passed up for promotions. Kids don't do as well if they have hearing loss. They tend to get poorer grades. Maybe you're less likely to attend college, less likely to attend professional school. I think we're underdiagnosing and undertreating hearing loss, not only in the U.S., but around the world.
Yeah, I couldn't agree with you more, Doc. I know a person for years had hearing, she would have a difficult time being in public, and even when we go out, and so she refused to go out and refused to socialize, and it affects a lot of things.
That's right.
Okay. In closing, what do you recommend our viewers to do, and does it affect any age group? I mean,
Any age group.
Yeah. So it doesn't make any difference.
No. So if you look at the spectrum of life, so children in America, if they have hearing loss, probably genetic. There could be CMV, which is a type of virus, or other things that can cause hearing loss. As kids get older, otitis media, which is ear infections, that can contribute to hearing loss. As kids get older into their teenage years, into their 20s, things like AirPods, right? If you listen to music too loud, that occurs. Yeah. And then what's going on at work? OSHA does a great job in getting people to protect their hearing.
Yes.
And wearing ear muffs, earplugs. But people are often around lawnmowers without hearing protection. Maybe I have workmen that may be cutting down trees around our house, and are they wearing hearing protection? When you use a vacuum cleaner regularly, all those things add up over time.
So tell me what's new in advances in the field, Doctor.
I've been doing this 25 years, and I think what's exciting is to see medicine advancing. It's advancing slowly, but continues to advance. One of the neatest things now are cochlear implants. These are electrodes that go inside the cochlea, which is a snail-shaped organ of the inner ear. And these electrodes that are made of platinum and wire, they go into the cochlea. And now we're using robotic technology to insert the devices in even a less traumatic manner. So the hope is that the results we saw 25 years ago with cochlear implants, and they were originally FDA approved in 1984, that they continue to get better and better and better. And so it's we're probably one of only 25 centers in the country that are doing robotic cochlear implantation. We were actually the first in the state to do it. We've done 19 patients so far with it. And so the hope is that patients continue to see improved outcomes and quality of life.
With the advances we have today, there's no need to have,
That's correct.
to have the hearing loss. I mean, with what you have here at Lehigh Valley, the doctors and the audiologists, I think it's great, Anything you'd like to say in closing before you bring Leeann on?
No, I appreciate it. Thanks for allowing me to be involved with this. We have a great group here locally, and you have phenomenal clinicians that can help diagnose and treat hearing loss.
And I have to compliment you, changing your last name to Samy. I think that's great,
I'm sorry to hear what you said.
My friend's Dr. Ravi Samy. He is the Professor in Chief OHS. I'd like to say the word, but I can't. Head and neck surgery as well. And I'd like to do a show on that someday, okay?
Absolutely, happy to help.
I find that very interesting. We'll take a break. We'll be back right after this. Well, welcome back to the Your Health Partner, brought to you by Lehigh Valley Hospital Hazleton. I'm Sam Lassant, learning a lot about your ears and hearing. Joining me now is Leeann Yetter, who is an audiologist up here in the Wellness Center. And Leeann, thanks for coming on the show.
You're welcome. Thanks for having me.
So you were telling me you have a little daughter who is 10 months old, right?
I do.
I wanted to start with the important things first, you
Right.
see. Well, that's great. And what's her name?
Danny Ellen.
That's good.
Yeah.
And she's all excited about being with her grandmom every day, right?
She does. She loves every morning she gets up, she's ready to go to grandma's house. So
Great. So being an audiologist, tell first of all, people like to know who they go to and when they're talking to. Tell me a little bit about yourself.
I'm semi-local. I graduated from Lehigh, and I did my undergraduate and my graduate degrees both at Bloomsburg University. I finished my graduate degree, my doctoral degree in 2017 from Bloomsburg University. And shortly after that, I joined the small world of audiology. It's very small.
Explain the training and the education that one has to go through to become an audiologist.
Well, typically your undergrad degrees is a 4-year degree, a bachelor's. It can really be in anything, but it's beneficial if it's something in communication sciences. My undergrad degree was in speech pathology and audiology. It's a dual major. After that, you decide whether you want to go for a master's in speech pathology or a doctorate in audiology. Doctorate is the entry level degree for audiology, so you really don't have another choice but to go for a doctoral degree. So that's another 4 years of training. Again, some programs I know might be like 3 years, but ours was 4 years. The entire 4th year is out on externship, so you're working hands-on with other audiologists and other doctors. And then you take your big exam at the end of your degree, and if you pass that, you get your license, and then you can start practicing.
So what does an audiologist focus on?
Well, audiology focuses mainly on the hearing organs. So we do work hand in hand with ear, nose, and throat doctors because obviously the ear is part of that same system that they work with. So hearing falls into that same category with an ear, nose, and throat doctor. We focus mainly on the hearing and balance organs of your ears. So we will do things like middle ear evaluations. A lot of times that's for kiddos if they have some fluid going on in their ears or recurrent ear infections. We also do regular hearing tests. We can do speech and noise testing. Audiology scope of practice includes balance evaluations because the inner ear includes not only your hearing organs, but the organs that are important for balance and knowing where you are relative in space. So, those are typically our main things, which then leads to, once you're diagnosed with an issue, then your treatment would be hearing aids if you have hearing loss, or maybe you have a type of hearing loss that can be medically taken care of, which then we would go back to the ENT to do that.
Yeah. When you say you work with them, I think it's unique here because you have the doctors here. Give me an example of how you work with them with your nose, ear, and throat. How does that work with your hearing?
Typically,
Give me an example.
Right. So you have a patient that comes in, they're claiming they have hearing loss.
Yeah.
The ear, nose, and throat doctor will evaluate them initially. So they'll take a look in their ears. They'll say, "Oh, I don't really see much wrong on the outside. Let's get you a hearing test and see what's actually going on the inside." So then they send them to us. We do a hearing evaluation, which includes typically a middle ear evaluation. And then the doctor will go over those results and decide, is this something that we need to recommend hearing aids for? Is this something that we can surgically or medically or take care of with medications? So it's a collaborative effort to find out exactly what's causing the issue and how do we treat
I
that.
find that very interesting. I understand you have some new hearing booth here, which we're showing the public right now. What is that, when you say a new hearing booth, what does that offer me?
This booth has never been used anywhere else before. Sometimes booths, when they're moved and they're taken apart and reassembled, they lose a little bit of their integrity and how much they can actually seclude you from outside sound. A brand new booth provides the best quality sound deprivation that you can get when you're testing hearing, which is very important because when we test hearing, it's to find thresholds. So it's the softest that you can recognize sound. So it's very important for everything else to be fairly quiet.
In doing a test, there are certain things that you look for, all right? A person knows when they're having hearing problems, okay? I mean, they can't hear. But sometimes people wait, and then what are some of so you find hearing loss, okay? What are some of the remedies you have? Is it medication? Is it a hearing aid? What is it?
It depends on the etiology of the hearing loss, meaning what's the actual cause of why you're having the hearing loss. Most of the time, it's a nerve loss. So if it's something that's nerve related, it's treated typically with hearing aids. If it's bad enough, it could be treated with a cochlear implant. If it's not something nerve related, if it's something more external, then we would go to, okay, that's when the ENT takes over and decides what course of treatment we would go through for that. Sometimes that includes, pressure equalization tubes, when you get the tubes in your ears. But that's all on the ENT side of stuff. We don't work with that.
All right, so your child is having some difficulty, you don't understand certain things. When should you have a hearing test? Should this be something like you do a physical exam once a year? Or, when should someone, well, you could tell, if your child's not responding, speech problems come from lack of hearing, right?
Right. Yeah. So children manifest hearing loss in several different ways. A lot of times, kids with hearing loss are mistaken for having behavioral issues or not paying attention or fatigue, like they're labeled as lazy, but really they're just tired from trying to hear all day.
Yes, yeah.
Right?
Yeah.
So hearing loss in childhood it's a very specific situation where we need to really get on that quickly, because we need to make sure they're developing language correctly. We need to make sure that they're able to learn in school. Those situations, again, if it's something that has to do with fluid in the middle ear cavity, or they have a lot of chronic ear infections, that's something that is taken care of by the ear, nose, and throat doctor. We still do hearing tests to confirm. But typically those situations are mainly taken care of by an ear, nose, and throat or otolaryngologist. If they do indeed have a nerve hearing loss, then there are plenty of children out there that wear hearing aids.
Yes. Mm-hmm. Now, another interesting thing is your balance. Mm-hmm. Sometimes, people, having concern with their balance. And I find it interesting. How does that relate to hearing? And I'm sure a lot of viewers out there, it's an interesting question, because sometimes you're off balance, okay? And it's related to hearing. You would think it's related to something else.
Well, again, that middle ear organ has both the hearing and the balance organs all in one, right? So then if something's going on, if you have some kind of virus in your inner ear, that will affect both your hearing and your balance at the same time. It can also, if you have some kind of disease of they're so closely related. Typically, if one is having a problem, the other one is also having a problem. So it gives a little bit of, a hearing test is an external way of looking at what could be a problem internally. It gives clues, it builds pieces of a puzzle. It's piece of a puzzle. So if someone comes in and they're having balance related issues, typically we like to look at a hearing test, because when we see the hearing test, if there's something odd with it or off with it or different from the last time they were tested, then potentially it could show signs of something that's going on with the balance as well.
That's amazing. So you tell a lot, like if a person's getting an eye examination, sometimes they could really tell what's going on by looking at the eye.
Right.
And it's the same thing with the hearing.
Absolutely.
Correct. Mm-hmm. What other services do you provide here?
We do provide hearing aids here, and we work with several different financial options for those hearing aids. Something that most people don't really think about is hearing protection. That's
hearing protection. What is that?
Right. So we can make custom hearing protection for people that work in loud environments, or recreationally they're in loud environments, if they like to go to concerts, if they like to shoot firearms, things like that. It's very important to protect the hearing that you have. So we can make custom hearing protections for those situations. We also make swim molds. So if you don't like water in your ears, or if you are one of those kiddos that have tubes, then we can make molds for that as well.
Now, if you want any information, the number is on the screen, my friends. It's interesting, isn't it? I would suggest that you give them a call. And at that particular point in time, they'll tell you whether you need whatever you need with your family doctor, etc. But at least you give them the information, correct?
Absolutely.
Well, you really gave me an education today.
Thank you.
Thank you, and good luck with your little girl.
Thank you so much.
My friends, that's the Your Health Partner. Remember, Sam at ssptv.com. You can watch all of these shows 24/7 on our website. And we hope you enjoyed the show and learned something today. We'll see you next time.